Hi, I'm Dr. John Shim, and today I want to talk about lumbar epidural steroid injections. Many of you have had this recommendation already made by your doctors. So what really is an epidural injection? To make it very simple, basically you take a small needle, you place it through the skin, and then the needle is placed right next to the nerves that come out of your lower back. I like to put the needle in what's called a transforaminal location. The needle was placed slightly outside the hole where the nerves come out of the spine, called the foramen. When you place that needle, it has to be put in a very careful position. The needle can't go too deep where it will cause irritation of the nerve, yet it has to go deep enough so the medicine will bathe the nerve. Now the medicine used is a steroid. Steroids decrease the inflammation. When you have a nerve pain at the transforaminal level or at the epidural space, a lot of times it's caused by a chemical spill caused by a disc herniation. The steroid medications help mop up or decrease the inflammation caused by this chemical spill. That's why the epidural injections can and often do work. Understand that the epidural injections is a multi-step process. First, the skin is cleansed. Then we use X-ray guidance to make sure we have the needle placed in the proper location for the nerve that's irritated. I use something called a transforaminal approach. That means the needle is placed through the skin, through the muscles, through the fascia, and just placed just to the outside of the facet joint and passing into the space called the foramen. In that foramen, you have to be careful not to put the needle too deep because you'll pierce the nerve. You also have to be careful not to place the needle in the small blood vessels that surround the nerve because that can cause a different set of problems. Once the needle is placed, the needle is aspirated or drawn back to make sure it's not actually in the wrong location. Then the steroid medication is delivered onto the nerve. With time, with the steroids, the inflammation of that nerve will decrease and there'll be less leg or back pain. The epidural injections is a very useful and at times very effective means to manage leg pain caused by nerve irritation. Understand, however, there are certain risks, so if your doctor hasn't discussed them with you, make sure, number one, you're off all blood thinners and off all anti-inflammatory agents. That small blood vessel that we talked about, you don't want that to continue to bleed if you accidentally pierce it. Number two, if you're diabetic, steroid medications can cause a significant flare-up of your blood sugars and may actually cause you to have some sort of diabetic crisis. And number three, understand that at times, even though it's not the intention of the procedure, you can have a flare-up of leg pain or back pain just by the procedure itself. In general, I would say about 85% of the time, people feel better with the epidural steroid injection. It doesn't work for everybody, but when it works, it definitely helps you get better faster. This is Dr. Shim talking about lumbar epidural steroid injections. I hope this information was useful to you. Thank you.